Hello everyone, I'm Dr. Palak Chugh and today we are going to talk about a very important topic in endodontics, something that often causes root canal failure, inadequate obturation. This topic may sound simple, but it's actually the key reason why even technically sound treatments can fail. By the end of this discussion, you'll know that what mistakes to avoid, how to detect them, and how to make your root canal treatment truly successful. Let's start with a simple truth. Even a small mistake in your obturation can make the entire root canal fail. Imagine you've done perfect excess opening, cleaned the canals beautifully, shaped it well, and then at the last moment you either overfill it or leave a void. All your effort can go to waste. Root canal successes is like a chain. If one link is weak, the whole chain breaks. That's how crucial obturation is. Obturation is the final step in the root canal treatment where we fill and seal the clean root canal space with gutta percha and sealer. Why is this step important? Because it blocks bacteria from re-entering and multiplying. You can think of obturation as the final wall of protection that keeps the root sterile. A good obturation ensures long-term success. Inadequate obturation means the canal hasn't been sealed properly. It could be short of the apex, overextended beyond the apex, or may have empty spaces called voids. Sometimes even entire canals may be missed. All of these allow bacteria to leak in or stay behind, and that means infection can come back. You might have done perfect cleaning and shaping, but if obturation is poor, the treatment fails. Let's look at the common types of errors. First is underfilling. This happens when you fill short of the apex. This leaves a part of the canal unsealed, which is a space for bacteria. Overfilling. When the material extrudes past the apex, it can irritate the periapical tissues and cause pain or inflammation. Voids. There are small air gaps in your obturation. They may look harmless but can act like tiny shelters for bacteria. Missed canals. These are canals you never located or treated, a very common reason for failure, especially in molars. Knowing these helps you to stay alert. Let's take a little break and have a laugh. This meme shows the classic situation. The post-op x-ray looks odd and you suddenly realize, oh no, I forgot the sealer. It's funny, but it happens. The idea is we're all human and we all learn from these small slips. So always double check your tray and your steps. So what happens if obturation is inadequate? The patient may return with symptoms like pain on biting, swelling or sensitivity. In severe cases, you may see a draining sinus or a periapical radiolucency. This means bacteria have returned or never left the canal system. Eventually, you may have to retreat the tooth or even extract it, so that one little mistake could mean the loss of the tooth. How do we know if obturation is successful? Look at the post-op radiograph. A good fill should extend to 0.5 to 1 mm short of the apex with no voids. Underfilling looks like the canal stops abruptly. Overfilling shows material leaking out. Voids show up as black spaces in the white gutta percha. Being able to spot these errors will help you improve fast. Prevention is better than cure, even in endodontics. Here, what you can do: use apex locators and confirm with working length x-rays. Always isolate with a rubber dam, it keeps things clean and dry. Master obturation techniques. Cold lateral is a good for beginners. Warm vertical gives better adaptation. Dry the canals properly and apply sealer evenly. And always take a post obturation radiograph. It shows you what went right and what didn't. Time for a mini quiz to refresh and interact. First is, what's worse, underfill or overfill? Think and share your logic in the comment section. True or false, a sealer alone is enough to seal a canal? So tell me your answer. If you take one thing from this talk, remember this: obturation isn't about just putting something inside the canal, it's about 3D sealing, perfectly adapting to the shape of the canal in all directions. Every millimeter matters. Take your time, don't rush the final step, and you'll reduce failures significantly. This one's for all the interns. I've been there. After our first obturation, we all look at the x-ray thinking, did I really seal it well or just stuffed gutta inside? It's natural to feel unsure. You'll get better with practice, with feedback, and with time. Don't be afraid to make mistakes. Just make sure you learn from them. I'd love to hear your thoughts, questions, or any clinical experience you've had with obturation. Thank you all for being such a wonderful audience. I hope you now feel more confident and careful when it comes to obturation. Keep learning, keep improving, and follow me for more tips, stories, and clinical insights.